Jen Mall, and welcome to Nurse Connect. I am an RN and a board certified nurse coach. I believe that connecting with others is essential to living a happy and fulfilled life, and that sharing our stories not only helps us to heal ourselves, but also helps others by inspiring hope and optimism. I am so grateful to share stories of these incredible nurses on their journey, and I encourage you to find a way to share yours too. Thanks for listening in. Hey everyone, we'll jump onto this week's podcast in just a moment. But real quick, if you're a nurse coach or a leader and are interested in developing a hospital-based nurse coaching and wellness program, then I would love for you to join me in my Facebook group, Hospital-Based Nurse Coaching and Wellness Programs. In this group, we share best practices and resources, as well as trainings to help you develop a successful program, which will decrease turnover and burnout, as well as increase employee satisfaction. Of course, we know this leads to decreased serious safety events and improved patient experience. I have got a free mini course that I can send you to get started on this journey. I will drop the link below, and I hope to see you inside the group. Have a great day. Bye. Hi, everybody. Welcome back to the Nurse Connect podcast. I'm Jen Mall, and very happy to have Kristie here with me today. Welcome.
Thank you. I'm really excited to be here.
Thank you. And we go way back, like worked together a long time ago. And so this is just feels a little bit full circle for me to connect with you in this way and to share your journey as a nurse. And it's really awesome to have you here. Thank you.
Thank you. Well, gosh, just kind of going off of that, how long ago was it?
Oh
you were
gosh,
like a nursing
a baby
assistant at one time, right?
Yeah, I was an ER tech, and I
Yes.
started at Roseville in 2004.
Okay.
So yeah,
That
and
was
then I
way
think right
back.
before I became a nurse, kind of connected with the clinical nurse specialist and educator group at our hospital, and
Yes.
kind of
Okay.
went from there.
Nearly 20 years.
Isn't
Holy
that
moly.
crazy?
Yeah.
Yeah. Yeah. So why don't we're here to talk about you. So
Okay.
let's start off. Like, how did you become a nurse? What has been your career path?
Oh my goodness. Well, I always knew that I wanted to go into healthcare. So
Oh,
from the fifth grade,
oh
like
my gosh.
I remember clearly watching a video, a health in our, health class, watching a video on the heart. And I thought,
Mhm.
I literally remember having like this light bulb moment where, literally a light bulb goes on. And I thought, okay, that's what I'm going to do. Now,
So cool.
in the fifth grade, I didn't know what
Yeah.
that meant,
Yeah.
but I knew it was something in the medical
Hmm.
profession. And so as I started to age and, get into high school, I thought, oh, well, I'm going to be a doctor. And my senior year of high school, my stepmom had a friend who was a nurse who came by and said, hey, let me tell you about nursing. And I thought, wow, that really sounds right up my alley.
Yeah.
So that kind of led me down that path, which I thought was really great because people now will say, oh gosh, you're so smart. But what people didn't realize is that I worked really, really hard.
Mm.
I mean, I was a B, maybe C student,
Hmm.
just working my ass
Yeah.
off. So anyway, I go to college, I get into nursing school. It takes me 2 extra years to get
Hmm.
in. So I finished my degree in 6 years because I had to retake classes because
Yeah.
that's how hard I
Oh,
had to work.
that's so hard.
And then graduated from UNR in Reno, worked up there for about 9 months, and then moved down to the Sacramento area with my then husband at the time and started my nursing career at Sutter Roseville. Now, the funny thing is, going to nursing school, I didn't know what I wanted to be,
Hmm.
like where I wanted to end up in nursing. I knew it wasn't family, kind
Yeah.
of like pediatrics, labor and
Yeah.
delivery kind of thing. Um, but I never even considered oncology
Mm.
because the one class that we could take before nursing school was pharmacology.
Hmm.
And, at the time, this was the early mid 90s, and the drugs that we had for side effects were not as many as we have
Yeah.
now. And so I just kept thinking, oh my God, I don't want to work in cancer care. Those drugs are
Yeah.
horrible. It's going to be so hard.
Hmm.
And then my first job out of nursing school is on an oncology unit in Reno, and I just absolutely fell in love
Oh,
with it.
wow.
Like fell in love with the patients, fell in love with learning anything oncology related. And when I came down to the Sacramento area and got that position at Sutter Roseville, it was, I thought I was just going to go to med surg because
Yeah.
I had less than a year of experience in oncology. And so why would the oncology unit take me? And I hit it off with the hiring manager and was hired on. And I said, at the time, she asked me, where do you see yourself? And I said, well, I don't really know, but I want to do this education stuff, but I don't know what that looks like. And what I didn't realize at the time is I was describing a clinical nurse specialist.
Yeah.
And so, fast forward a few years, I end up going and getting my master's degree as an oncology clinical nurse specialist. And, I was able to work. At the time, I thought I had the best job ever. I loved program management. I loved educating the patients and the staff. I got to work really closely with the physicians. It was just a great position, but I saw that there was something more I could do. And so in my CNS credits, my master's credits were still good. So I said, well, why don't I do a postmaster's NP? And, it's funny because looking back, I always thought, oh, I'm never going to be a nurse practitioner. And then, here I am. But ended up getting a postmaster's and able to stay in oncology nursing. Although I will say when I graduated with my postmaster's, it was harder to get a job as a nurse practitioner than it was as a new grad.
Really? Why is
Yes.
that?
Everybody wanted experience. Now, granted, I had 6 years under my belt still as a CNS, so advanced practice, but nobody translated that into advanced practice as a nurse
Oh,
practitioner.
interesting.
So it took me 2 years to get a position as a nurse practitioner after I finished my postmaster's, which was kind of interesting. And then was able to work with 2 oncologists who knew my background, knew my skill set. And I learned so much from them, and I'm eternally grateful. And then in 2016 is right around the time I started. Well, we had known about survivorship for quite some time since the IOM report from 2006, Lost in Translation. And so I'd known about survivorship, and we had, Sutter had thrown around the idea of a survivorship clinic, but nobody really knew what that meant. And I felt like that was the moment, or that was the time, I should say, not a specific moment, where I realized that we were missing the boat on the whole person.
Yes.
Like patients became very siloed in their diagnoses. So you're just your cancer, or you're just your diabetes, or you're just your hypertension, whatever. And I had this epiphany of, wait a minute, if we're thinking survivorship, we have to think about the whole person. And that kind of started my journey on this integrative functional medicine side and my own personal development journey. And I ended up being recruited to another healthcare system who, when I got there, they asked, what would your ideal job look like? And I described it like, I would love to work with survivors. This is what I would, blah, blah, blah. And the manager, the director at the time, looked across at me and she said, that's funny because that's exactly what we're hiring for.
Oh my gosh.
Yeah. So it was really, I was like, this is weird.
Yeah. You just manifested that.
It was really weird. So I left my first NP job, went to this other healthcare system, and really helped them build their survivorship program. In the process, though, I had built such a great clinical skill set with managing acutely ill oncology patients who were undergoing chemo. So it was kind of this, well, survivorship clinics in general tend to be a little bit of a challenge to get physicians to send patients to.
Okay.
I haven't been able to figure out why.
Mm-hmm.
Some of it is education. Some of it I
Mm-hmm.
think is just um, the dynamic of having your flow and having
Mm.
one more thing to add to your flow of a
Mm.
referral. Like
Yeah.
I'm not thinking down that road. So in the process of helping to build this survivorship program, they recognized that I had this skill set. And so I just started managing between two physicians, pretty much all the breast, GI,
Yeah.
GYN, some head and neck, active cancer
Mm-hmm.
diagnoses. So I was kind of had my feet on both sides of the spectrum. And then in 2020, we know what happened, and the whole world shut
Yeah.
down. And I think what a lot of people experienced was a very toxic workload because of that
Mm-hmm.
shutdown. And what happened to me was all the doctors that I worked with went home to work, and I was
Mm-hmm.
left in the clinic alone
Oh,
to support the infusion center, which
yeah.
I wasn't afraid to be there.
Yeah.
I was willing to see patients come into the clinic. I was willing to go to the infusion center, which was kind of right across the hall. Um, but when you're taking call from home and I'm the one seeing the patients,
Yeah.
it was got to be an unhealthy situation.
Yes.
So I started doing my own research, and
Mm-hmm.
something popped up about nurse practitioner entrepreneurship.
Mm.
And I had never even thought about having my own
Yeah.
practice because, that just seemed really hard. And I'm not a business minded
Yeah.
person. And I just started doing more and more research and finding all of these things. And then I thought, oh my gosh, I could probably do this.
Mm-hmm.
And so I did. I opened up my own telemedicine practice that was focused on integrative oncology to support patients who were
Yeah.
going through chemo and those who had finished, or those who just wanted prevention of,
Mm-hmm.
the things that they can do to prevent cancer, or they had a history of cancer and
Yeah.
they wanted to prevent recurrence, or even patients, or I should say clients in
Yeah.
general, helping anybody who was willing, that wanted to help their overall health and wellness and their
Yeah.
resiliency. And as I started my telemedicine practice in January 8th, 2022, no, 2021.
Uh-huh.
And then it was open only to Nevada clients. And then I opened to California and then Idaho and Washington. And now I'm pretty much across the United States.
Wow. That is
Hmm.
incredible.
Yes. And along the way, I've opened my mind and my education to a whole different world within this metabolic health,
Mm-hmm.
this integrative health dynamic. I've been mentored by some amazing naturopathic oncologists and what
Yeah.
they had to do for patients. And that has been probably the most rewarding thing for me, is to step outside of the standard of care or paradigm
Yeah.
and recognize that there is more than just a pill for every ill.
Yes. Yes. Yes.
So
You're
that's
treating the
kind of,
person
yes.
and what they
And
need.
treating their metabolic function.
Mm-hmm.
And one of my favorite, it was like it was another light bulb moment where, being educated and going through some coursework with Dr. Nasha Winters, who's
Mm-hmm.
a naturopath, and she wrote an amazing book called The Metabolic Approach to Cancer. And prior to taking her practitioner course, I had read her book like three
Mm-hmm.
times. I was trying to implement these things. But she says, test, assess, address, don't guess.
Mm. Mm.
And I thought, oh my God, that's brilliant. Why aren't we doing that in medicine? Why aren't we
Mm-hmm.
doing that in nursing?
Mm-hmm.
Because we're just throwing things at patients and they might not need them.
Right.
or, like that it's that pill for every ill. Or even in the integrative and functional medicine side, I've seen clients who end up being on so many supplements that have just been thrown at them that actually I try and pull back and say,
Mm,
let's start from scratch. What do you actually need?
that's
And
helpful.
for most people, it's not a lot of supplements, but we just think more is better, right?
Right.
So, when we can test, assess, address, don't guess, we
Hmm.
create a whole different paradigm for patients.
Wow. I love it. Okay, there was so much good stuff there. First, I just want to acknowledge you and just say it's incredible that you have like kind of followed your intuition and just kind of allowed this journey and path to unfold, because there are so many options out there and it can be really overwhelming, but you've just kind of kept plugging away and it's like, okay, I'm
Mhm.
interested in this, let me explore that a little bit and let's see where that takes me. And just being open to
Mhm.
the different things that nursing can offer. You're obviously working as an advanced practitioner now, but that has been a journey and it's all kind of
Mhm.
encompassed into this nursing realm.
Right.
It's amazing.
Well, especially when I didn't even believe I would be where I'm at today.
Yeah. Yeah.
I just saw myself starting out nursing thinking, I'm
Yeah.
just going to be a bedside nurse.
Yeah.
And that was okay. Like I was
Yes.
super happy to do that.
Yeah.
So, excuse me, I didn't know that there were these other
Yeah.
avenues. I didn't know there was a CNS avenue. I knew there was a nurse practitioner, but that just seemed really hard.
Mhm. Mhm.
And
Yeah.
so I didn't know if I was smart enough.
Yeah. Oh, and that's such a good point because I was also a BC student
Mhm.
when I worked hard. And I think,
Mhm.
and I've been very successful in my career as well. And I think sometimes that having that mindset of like, I'm not smart enough to do that because I had to work really hard at this, that doesn't limit you from anything. Like
Right.
you have unlimited potential. And if you want something, you can make it happen. And I think just the two of us right here, and not, and we know a ton of other people that have also struggled, but to know that you truly could do whatever you wanted to.
Right. And I
Yeah.
just always had this sense that, you know, walking away from my CNS position
Mhm.
as I was finishing up my NP
Mhm.
certificate it was really hard. Like it was
Mhm.
very emotional,
Yeah.
um, leaving physicians and nurses and coworkers that I absolutely
Yeah.
loved and adored. But I just knew that if I stepped off the cliffs, there would be a road to meet me. And I've never been afraid of change, which a lot of
Mhm.
people are like so afraid to change. They're
Yeah.
they're willing to stay in a shit job
Mhm.
just because they have to pay the bills. And
Yeah.
I've I've been cautious, but I have always been willing to make a change.
Yes.
And I
Yes.
think that's something that we need to embrace and be open about because there's so many things within nursing. And
Yeah.
I'm still learning. Oh my
Yeah.
gosh, I love it. I love
Yeah.
that I'm continuing to learn.
Yeah, me too. I mean too. I love that lifelong learner element. It's just there's
Mhm.
sometimes it gets overwhelming because I pick up too many things.
Right,
But I love the fact that we can always learn and grow. There's always something different and new and exciting and you don't have to be stuck somewhere.
right.
Yeah. Yeah, that's amazing. So when you say you're a full telemedicine, all of your clients are virtual?
Mhm.
Okay. Oh,
Because I also recognize that
yeah.
I've been at the clinical bedside, chair side,
Yeah.
whatever you however you want to say word that long enough that I
Mhm.
can look at somebody and see clinically what's going
Yeah.
on with them, hear what's going on with them.
Yeah.
I always say, if I can, sometimes it's a little hard to see how much what's all going on when you're only seeing this
Yeah.
much of somebody. But people, I have been really amazed at how much they're willing to share
Mhm.
via Zoom calls and just do the deeper dive.
Yeah.
And I do recognize that I'm working with a totally different population.
Yeah.
Like they're jumping in both feet. The C word is scary. They want to do
Yes.
all the things. And I want to help them do all the things if they need to do all the things.
Mm-hmm.
I'm still amazed, Jen, at how many nurses and physicians and dietitians still tell patients that it doesn't matter what you eat, just don't
Mm.
lose weight. And we
Wow.
know,
Yeah.
like, if what you eat is problematic under normal
Yeah.
circumstances, you mean to tell me while somebody's actively cancering
Right.
or going through treatment, it's not going to be that much more of a
Mm.
problem? So just kind of that, so that's where my avenues of, nursing education and I'm passionate about educating oncology nurses, and I'm
Mm-hmm.
passionate about educating patients, and where I'm not, I mean, let me back up and say it's so funny because I can tell patients, you're going to go in for chemo tomorrow, and this is
Yeah.
what they're going to say and
Yeah.
do. And they'll come back to me and they're
They
like,
did
oh my God, that's exactly what they said and did. And they sent me out the
Yeah.
door with an apple juice.
Yeah.
Um, but I think that part of it is I don't work directly with physicians anymore with
Wow.
this telemedicine
Amazing.
practice. So my goal is to now empower my patients to have these difficult conversations
Yeah.
with their team, their
Mm-hmm.
standard of care team, to say, well, if they've got you on a regimen that, maybe is not working based on, their lab parameters or their
Mm-hmm.
genetics or whatever, then I want them to have all the information at their fingertips to say, help me understand why,
Right.
like, should I be on this?
Mm-hmm.
You know what I'm trying to say? Like,
Yeah.
they're staying, or why shouldn't I worry about my blood sugar? Or
Right.
why aren't you drawing a vitamin D level?
Mm-hmm.
Or all the
Yeah.
things.
Yeah. Well, you're empowering them. And I think we
Absolutely.
know that when somebody is empowered and they have the knowledge and tools and resources, they own their care. They
Hmm.
take better care of themselves. I mean, we learn this early on in nursing school, but then oftentimes we become an enabler. We just
Yes.
take care of it because we don't want them to worry about it. It actually reminds me of that. And I'm going to mess this up, but there's a Bible verse about, give a man a fish and he eats for a day, teach him how to fish and he eats for a lifetime, or something along those lines.
Yeah.
And that is where in coaching, and I'm certain that you do, coaching in your practice, because it's, brings it back to the patient, but like teaching them how to take care, how to do it for themselves so that
Yes.
they can then be empowered to ask the questions, be
100%.
curious. Yeah.
And
Yeah.
and I tell people too, like, if you are not jiving with your
Yeah.
clinician,
It's okay.
it's okay to ask
Mm-hmm.
for a different a
Mm-hmm.
doctor or a different nurse
Yes.
practitioner or a different
Yes.
whomever. Like,
Yes.
you have to jive and feel comfortable with the care
Yeah.
that they're recommending.
Mhm. Yeah, because it's your life.
Hmm.
It's your, and
Yes.
your lively, and your what's the word I'm looking for? How you're living your life. Like, it's not
Yes.
just living, it's how well are you living, and
Right.
to make it through treatment and actually thrive in your life and not just
Right.
survive to get through it.
Well, and I
Um,
think too, it's funny because people will pigeonhole me kind of into nutrition,
mm,
because I do talk a lot, through
sure.
social media. I talk a lot about food or not supplements, metabolic function and
Mhm.
whatnot.
Mhm.
But I try to explain, like, it's more than just food. It's all these foundational things of food, movement, sleep, stress reduction, and then we can layer the fun stuff on top. But it's not just one thing,
Yeah.
but it's all the things. And then I think it's also so important to be a clinician, and I don't care if you're a bedside nurse or you're
Yeah.
a physician. I think it's important to be a clinician who walks the walk. You're not just talking the
Mhm.
talk. And
So true.
I tell patients all the time, I wouldn't ask you to do something I'm not willing to do
Yeah.
or doing myself,
Yeah.
and I think that's really important.
Mhm. Mhm. Yeah, and it's hard, and
Hmm.
you can acknowledge that it's hard to make changes, to do different habits, to support
Yes.
yourself, and I found that just bringing things down to small little chunks is
Baby
helpful.
steps.
Yeah. Yeah, but it is doable. And I think you start to notice once you implement a few of these things in different areas that you start to feel better. And then that kind of reinforces
100%.
those positive behaviors.
Yeah.
Yeah. Yeah, that's great. And so I get the gist that you still support traditional treatment
Hmm.
and also the supportive care and elements that could make it almost, I don't want to say easier because there's nothing easy about having cancer and going through treatment, but maybe soften that a little bit, like side effect wise. Would you explain
Absolutely.
that?
So, I look at what are the things that patients can do, not only
Mm-hmm.
while they're going through treatment to help
Mm-hmm.
maybe ease side effects, but
Mm-hmm.
also recover when they're done.
Yes. Yeah.
And I'm also looking at labs. When people sign up with me, they're signing up for at least a 4-month block of time
Mm-hmm.
because you can't make
Yeah.
changes in a one and done
Yeah.
session. So, and then they can roll over if they want, or there's a lot of creative ways that we can do that. But really, it's what are the things that we can do to help? What are the things that I can do to help people get through treatment more
Yeah.
successfully and then into healing when they're done?
Mm-hmm.
And for everybody, it's a little bit different. So, 99% of the time, there's always food involved,
Yeah.
right? We have to eat, but then we should be looking at what we're eating. So,
Yeah.
I really try and help people get into a low carbohydrate uh, dynamic. For
Mm-hmm.
some people, that's getting them into nutritional ketosis.
Mm.
Some people, it's, not quite that level of blood sugar or ketones,
Yeah.
but we know that there's benefit to that. We know that patients do better with that. A lot of times, I have a lot of patients who are going through breast cancer treatment,
Mm-hmm.
and I see fasting as a
Mm-hmm.
really good tool before chemotherapy and slightly after to help
Yeah.
mitigate some of the side effects. And that's been well elucidated in the research.
Yeah.
So it's just helping them with those tools, but it's also like, what are the things if we can look at labs that show, okay, you're deficient in vitamin D. You have to be
Mm-hmm.
on this supplement.
Mm-hmm.
If you're having issues with methylation by surrogate homocysteine levels being high, can we get you on a B complex?
Yeah.
You know what I'm saying? So, and even, when I'm looking at a metabolic panel, I'm looking at something as simple as a fasting insulin level. And
Mm.
I used to say to patients, you know what? Here's the list of labs that I would like done.
Yeah.
Take them back to your primary, see if they'll get them ordered so then you can get them covered by
Yeah.
insurance. And there's been probably less than 5% of primary care physician NPs that would
Mm-hmm.
order the labs or would even order
Really?
all of the labs because there's so much within our standard of care
Mm.
paradigm that says, "Oh, we don't need that. We'll just look at an
Mm.
A1C," but did we consider a fasting insulin? Because
Right.
a fasting insulin can show insulin resistance. Now they're even saying maybe 12 to 20 years before it picked up on an A1C.
Wow.
So, I'm looking at, okay, yeah, your A1C looks pretty, but
Yeah.
your fasting insulin shit. So like
Yeah.
how can we get things back in alignment?
Yeah.
So it's those little things that sometimes it's I think part of the unique nature of being a nurse is I know both sides.
Mm-hmm.
I know the standard of care side. I've been intimately educated in regards to this integrative side as
Yeah.
well. But I also know when to say to the patient, let's just do what we can do.
Yeah.
And if all you can do is all you can do,
Mm-hmm.
then there's no point in me pushing for more.
Right.
And so part of it is also recognizing I can't do more, I can't work harder than the patient. And
Right.
sometimes I'm guilty of, oh my
Yeah.
gosh, if we could just do this, if we could
Yes.
just do this, but they got to be willing to go there.
Yeah. Yeah,
And
for
most of my
sure.
patients are, which is really fun for me because then
Yeah.
we get to branch out and look at utilizing not only food, but I have a what we call in my world a terrain advocate, which I always
Mm.
explain is like a health coach on steroids. Like
Yeah.
it's all things internal terrain involved. But it's also looking at different supplements that maybe aren't the norm or
Mhm.
off-label medications like low-dose naltrexone and
Mm.
mistletoe therapy, which I don't get to incorporate
Yeah.
in the standard of care world.
Yeah.
But there's so much data behind integrating it in the integrative side of the world.
That is so cool.
Yeah. I mean, I think that has been one of the most fun things for me
Yeah.
to learn is, well, let me back up and say right around that 2016 mark
Mhm.
when I
Mhm.
started this, kind of aha moment of the whole person, that's right around the time where I was more open to these other types of care, if you
Mhm.
will, and patients coming to me and saying, "Do you know who this person is? Have you read this book?" And I'd say, "Don't know who they are, don't know, haven't read the book, but I'm going to go out and get it and I'm going
Yeah.
to educate myself because either I want to read it and go, oh my gosh, there's so much more that we can do, or this is wacky, you cannot do this."
Right. Right.
Like I want to give them a better understanding. And so that has been my journey is I've learned so much from my patients
Mhm.
first, and then that added to my education as well.
Oh, I love that. And I think it is important for us as nurses and clinicians to be up to date on that. I mean, there's no way we can know everything, but like when
Right.
somebody brings something up or forward, that it is kind of our responsibility to take on
Yeah.
that. Like, let me look into that.
Instead of just
Yeah,
poo-pooing them, and a
yeah,
lot of times that's what happens,
yeah,
but I'm like, "Oh, tell me more.
yeah, yeah,
Really, tell me more."
yeah.
And how can we expand on that? Because
Hmm.
there's a lot happening in cancer care that is standard of care, but it's not within the confines or the
Okay,
box of the healthcare
sure,
system.
sure.
Does that make sense?
Yeah, yeah. It does seem like you really have the almost the best of both worlds
Mhm.
of being able to, be the medical model, but yet and then the holistic model and incorporating. And I don't even like to call it alternative anymore because
Right.
anything is almost fair game. And in this world, we're seeing so many what used to be considered alternative treatments are now
Mhm.
mainstream. And
Right.
and then we get into all of the energetics and somatics and all of that comes into play
Yes.
and it's just really fascinating. I'm glad to see there's more research being done in these areas too,
Mhm.
books being written, papers, and it helps to validate a little bit more, like I think what we already kind of knew.
Yes.
Yeah.
Yes. Well, and you know, I often will say, I was the person because this is how I was raised in
Uh-huh.
oncology nursing in
Hmm.
the late 90s, early 2000s.
Hmm.
Oh, you can't eat, just get Carnation instant breakfast and mix
Mm.
it with whole milk and ice cream just so you get the calories down.
Yeah.
Now I think back and go, "Oh my God, what was I
Yeah.
doing to people?"
Yes. Yes.
But you if you don't know any better, you
Yes.
don't know any better. And
Exactly.
so now to see this evolution
Hmm.
over time to really understanding this metabolic
Yeah.
dynamic and realizing that, you know, the ancestral dynamics of food
Mhm.
were never the problem. It's
Mhm.
just all this other garbage that has
Yeah.
been added in. And so then you just again, it's when you know more, what is it? When you
Mhm.
know better, you do
You do better.
better.
Yeah.
And, that's again, I go back to, gosh, my husband laughs all the time because of the Amazon is always bringing another book. There's another book. There's another book. But I'm fascinating with
Yeah.
being open-minded
Yeah.
to all the little nuances
Yeah.
and bio-individuality of patients. So what works for one person is not going to
Mhm.
work for the
Mhm.
next.
Mhm. Yeah. And I love that I'm certain that your patients, clients get so much value out of you honoring that is that they are them. They're an
Yeah.
individual. And so to have somebody listen to them and take into account what is individual and what they need,
Hmm.
that is so powerful because we don't have time for that, unfortunately, in our medical model
Right.
and the hospital system. you were in and you were out, and this is the
Yes.
check boxes that are
And
there, and it's
I
hard.
actually am really surprised at how many clients get to me and say, "You're the first person who heard me
Mm,
or listened to me."
yeah.
But then on the flip side, when I get patients, so I love word of mouth referrals. That's
Hmm.
the biggest form of a compliment for me.
Yes.
But when I get friends who then compare notes, and then I
Yeah.
have to say, time out. Like,
Yeah.
this person, Jane, is very different than you, and
Yeah.
you are very different than Jane. And so what we're doing
Yeah.
is not the same. And here's why.
Yeah.
And so that's an interesting dynamic that I've never really had to navigate before,
Yeah.
because everything has been a check the box approach or a blanket approach,
Hmm.
regardless of the situation, right?
Hmm. Yeah. Yeah. Oh, this is awesome. As we're kind of starting to wrap up, I just want to see, is there anything else on your heart that, you either wanted to bring up today, or a message that you want to share either to nurses or um, folks out there struggling with cancer? Anything in there?
Gosh, that's like the
A
biggest
loaded
question.
question. I made that pretty
Uh,
broad.
yeah. I think for nurses, I mean, nurses who know me know that my passion for never stop learning. Like,
Hmm.
we just have to continue to
Yeah.
ask why, question things. Like, I've always said, like, I will do anything you want if you give me you tell me why.
Yeah.
If you just say because I said so,
Yeah.
not going to work for me.
That's the way we've always done it.
Not going to work for me. I will fight you tooth and nail.
Yeah.
And so I encourage nurses to do more of that rather than just falling in lockstep
Yes.
to the way we've always done things, or that's just how it is.
Hmm.
Continuing to push the envelope and ask, well, why is that? Why are
Yeah.
we doing it this way? I think that's so important. And then from a patient perspective, I would say, gosh, follow your gut. If things don't feel right,
Hmm.
it's okay to make a change.
Hmm.
It's okay to pause. As soon as well, I'll say two things. As soon as somebody's diagnosed with cancer, in my experience, it's like, okay,
Hmm.
I want it out yesterday.
Yes.
And the reality is that for most people, it's probably been growing for quite some time.
Yeah.
So we have time to take a deep breath and regroup and find the best possible treatment plan,
Good.
whether
Yeah.
that's standard of care, it's integrative care, or it's a combination of the
Yeah.
two. The other thing I will say is that if in my clinical experience, when patients are finished with
Hmm.
treatment, I've learned that that can be one of the most sensitive times, because
Mm.
many times people will say, I'm done. Now I can go back to normal.
Mm.
Well, the normal in which they
Yeah.
lived allowed the cancer to grow.
Yeah.
So let's reshift what your new normal is going to look like so that we can optimize your health, your overall wellness, your resiliency, and
Hmm.
hopefully decrease risk of recurrence or having to deal
Right.
with a cancer diagnosis again.
Right. Wow, that's awesome. Kristie, where can people find you?
You can find me on social media. Kristie Howlett NP is Instagram, and Kristie Howlett NP on Facebook. You can find me at my website, which is howlettintegrativecancercare.com. Yeah,
Perfect. And I'll be sure to put that in the show notes.
super.
Yeah, thank you again. It's been so awesome to chat with you.
Yeah.
I love that, having the connection from before and learning about your work now. And I know you make a difference for a lot of people, and I'm grateful that you're doing this work.
Well, thank you so much for having me. I really appreciate this conversation, and
Thank you.
I appreciate being able to share my story and
Hmm.
hopefully help more people just know that there's a lot more you can do
Yeah.
out there. Whether you're a
Yes.
nurse or you're a patient, there's so
Yes.
much more.
Agreed. Agreed. Awesome. Thank you, Kristie. And thank you, everybody else. We will catch you next time. Bye.